Sanctuary policies have the potential to inform strategies for protecting the health and well-being of immigrant and refugee children and families, something especially relevant today. As healthcare providers and pediatricians, many of us are concerned about the impacts of current events and shifting political climates on our immigrant and refugee communities. With that comes concerns about what policies may actually support such communities and protect their health. So what are sanctuary immigration policies? Well, by definition, they address the jurisdictional separation between local and federal authorities regarding immigration enforcement. For many in health policy and services research, the concept of a, quote, sanctuary policy may still remain vague in practice and application, but these policies could have very real impacts on immigrant child and family health outcomes. A first step before assessing those potential health outcomes is to understand the details of their contents, because they're not all created or even written the same. With the support of a PolicyLab and CPCE pilot grant, my team and I conducted a content analysis of U.S. sanctuary immigration policies to explore this very concept. Thanks to an existing, unique repository of U.S. sanctuary immigration policies, we examined those policies that ranged from 2009 to 2017. We found that sanctuary immigration policies fell into two large buckets. As expected, the majority of policies related to policing and governing, such as the handling of requests from ICE by local law enforcement. However, nearly 60% of policies had content related to a second theme, supporting immigrants in communities. This was via antidiscrimination, inclusion, trust, and privacy, for example. A key finding was that these policies, those that supported immigrants in communities, had a further subset, specifically greater than 60%, that contained health-promoting language. For instance, some policies focused on enhancing access to public health and social services for immigrant communities, and others highlighted how fear and stress within those communities contribute to adverse health outcomes. With a child's health lens, we found some policies explicitly stated the unique impacts on kids and families. For example, such policies use language that opposed family separation, promoted reunification, and highlighted the particular needs and vulnerabilities of children. Using our research, policymakers may be able to examine the language used in existing policies to help inform the language in new policies, specifically aimed at supporting positive health outcomes for children and families. Researchers can use our data as different variables or exposures in future analyses aimed at understanding those multi-layered impacts of these policies and the language they include on immigrant health outcomes. Our hope is to use these findings to understand if these policies are actually impactful at protecting child and family health outcomes. Policies may aim to be helpful, but they could just be words. We don't yet know if we truly have an impact, and that's what we hope comes next.